Okay. Still see two in the lobby, so I'll just give it one more moment. Okay, welcome everyone to this year's first session of the Occupational Health Clinics for Ontario Workers, or OHCOW's annual October and Beyond series focusing on occupational diseases. I'm Krista Thompson. I'm an occupational hygienist with OHCOW, and I will be doing some of the moderation today. We start this session of October in October and continue through November for 5 sessions focused on different facets of occupational disease. We'll be doing this every Thursday for the next 5 Thursdays, including today, from 12 to 1:30. Before we begin, I'm going to mention that we are recording live and it's being broadcast on YouTube, so the recording will live on YouTube after this. Those who watch live will get a link near the end of each session in order to request a certificate of attendance for professional development and certification or maintenance purposes. We do expect attendance for the majority of the session to receive the certificate, which is why we put it out near the end. Today's theme is an overview of the Ministry of Labour, Immigration, Training and Skills Development, and the Ontario Health and Safety System Partners updates and priorities for occupational disease prevention. Next week, we'll have a session on WHMIS and chemicals, followed by exposure assessment on the 13th of November, occupational diseases and reporting on November 20th, and we will end on November 27th with a focus on protecting vulnerable workers. Today, I'm going to start our October series with a land and water acknowledgement based on guided by OHCOW's values. The Indigenous peoples of what's now called Canada, to them, both the land and water are vitally important to their identities. The relationship with the land isn't just food and living, it's also part of their culture and spirituality. In the same way, their relationship with water is more than sustenance, it is a method of travel and important to their health and cultural well-being. With this said, OHCOW recognizes the First Nations, Métis, and Inuit peoples who live all over Ontario and across Canada. It's also important to recognize Indigenous workers are experiencing intersectional occupational issues. Due to a variety of socioeconomic factors and systemic racism, Indigenous peoples are less likely to have access to formal and informal training and education. They're also underrepresented in professional, scientific, and technical services. To add to that, Indigenous applicants are less likely to be hired even if they are qualified. And if they are hired, they're more likely to face workplace discrimination and racism. Indigenous peoples are more likely to have cumulative health issues from both occupational and environmental exposures from industries located close to where they live, further compounding their risks. All that said, OHCOW recognizes these disparities exist in the workplace setting and in broader society, and we wish to do what we can to promote occupational health in all workers, including Indigenous workers. So now I'll turn the session over to Kimberly O'Connell, Interim Chief Operations Officer at OHCOW and past co-chair of the Occupational Illness Prevention Steering Committee, on Ontario Health and Safety System collaboration with the ministry. Kimberly received her Master of Science applied in Occupational Health, specializing in industrial hygiene from McGill. She's a certified industrial hygienist, a registered occupational hygienist, and a Canadian registered safety professional. Kimberly also has a broad and in-depth technical knowledge of health, safety, and environmental issues with a focus on primary prevention of occupational disease. With over 25 years of experience in OHS and a strong belief in collaboration and teamwork, her passion prevention, which stems from the loss of a close family member to a workplace fatality in 1993, is infectious. So welcome, Kimberly, over to you.
Thanks, Krista. I'm just checking in if Dr. Moody has joined us because
I
he's...
did see him, yes, just now.
Oh, that is great news. I was going to pinch hit, no pun intended, if you weren't able to be here, and we're so happy to have you. I promise I won't keep this on. It's a distraction, but who is not proud this morning? And it sort of goes on theme of our leadership and your leadership leading the way nationally, and more on that later. So I'm thank you, Krista, and thank you to the whole team that put our flagship event on occupational illness prevention together. We reached to all the system partners. We have participation from almost all. and throughout the few weeks together. Um, and we'd like to lead off with welcome words from our leader. So Dr. Joel Moody has been the Chief Prevention Officer and Assistant Deputy Minister at Ontario Ministry of Labour, Immigration, Training and Skills Development since 2021. He also holds an appointment at the Dalla School of Public Health as an adjunct professor. He's an American born and has studied across North America, earning an undergraduate degree in civil and environmental engineering at Duke and Master of Public Health studying in International Health Epidemiology at the University of Alabama, Birmingham. He did postgraduate work in epidemiology and biostatistics and earned a medical degree at George Washington University. He did additional work at the University of Toronto in cancer epidemiology. His diverse background allows him to speak, listen, and emphasize effectively with different groups on safety during the pandemic times and otherwise. And that might be a little old. I'm sorry, Joel. That was but over to you for to welcome us today.
Yeah, no, Kimberly, thank you so much, and I appreciate those very kind words. Lot is going on, and I definitely enjoyed the hat. I'll remind myself, I do now live in Canada. I was in the U.S. when my beloved Braves lost the first time to the Jays, but I'm rooting for the home team now. So go Jays, go! It's an exciting time. And with that, I just want to say thank you. Pleasure to be at this kickoff meeting. OHCOW's October and Beyond webinar series. Each year, OHCOW, you use this platform to really bring people together across the province, and even beyond. I remember last year you had people from different parts of Europe that were on, because ultimately it's about sharing one goal, to better understand, prevent, and ultimately eliminate occupational illnesses. So first, to my colleagues at OHCOW, the Occupational Health Clinics for Ontario Workers, your leadership, your innovation in this space, want to say thank you very much. It's your education, your research, your collaboration, all of those things that you are helping us to continue to see the full picture of what prevention can look like. It's across every sector and across every type of workplace that exists. I want to say thank you for helping me with this year's theme. So beyond barriers, uniting for occupational illness prevention. Can't be more fitting. And you may talk a little bit more about what's happening within the Canadian and global landscape. But we know that historically and even now, occ illness is a complex item. Usually develops slowly, silently over time. The causes, the associations can be difficult to truly understand, to trace. And sometimes it's very easily for those practitioners to overlook those early symptoms. All too often, at the end of the day, the impact to not only the individual, but their families and their community is underestimated. But we know at the end of the day, illnesses do affect people. They affect their communities, they affect their communities and their families. And my words, all of this can be prevented, because it's not just something that we want to avoid from a statistical standpoint. It's not just something that we want to be able to measure and monitor, but ultimately it's about the individual and their lives. So going beyond those barriers means more than just identifying risk. It means addressing the systems, the silos that keep us from acting sooner. It means ensuring that workers, the employers, our healthcare professionals, our researchers, we all have the tools, knowledge that we need in order to prevent and build those healthier workplaces, which we know exist. What have we learned from our data? What is the science telling us? What is the lived experience telling us? And then how do we turn that knowledge, those practical ideas, into what we know as prevention? So your series, OHCOW, has become such a vital part of that process. You're translating those complex information into accessible, actionable insights. As you go through your series, I wish I could listen to all. I've seen the dates. I'm booked for some. I apologize. But it's those discussions on the topics: exposure control, climate, work, psychosocial hazards, new technologies maybe. Those are the things that are going to help shape us. as we continue to advance OC illness prevention across this province, continue to advance OC illness prevention across this country. And so that progress doesn't happen unless we are all working together. So at the Ministry, Labor, Immigration, Training, Skills Development, once again, we all win a prize if we remember those. And also through the work that I'm doing for you all and my office does for you all. We are deeply committed. We want to continue to strengthen the system. And that really is about how we do our research, creating capacity, promoting those collaborations, and even more so, sharing that clear vision. We talk about it. Every worker in Ontario, no matter what their job is, what their industry, their background, has the right to be safe and healthy in their workplace, free from harm, free from preventable illness. So you're going to kick it off today. Happy to be here. For the members, engage with everyone, share, discuss, talk, and once again, take inspiration from each other. Because as we continue to build and unite our efforts, I know, as you said, Kim, I've been on since 2021. I've seen immense advancement, even just these 4 short years that I've been able to be your Chief Prevention Officer. Because it's when we unite our efforts across multiple disciplines, sectors, barriers, boundaries, all of those things that we know can impede at times, we do build a stronger, healthier, more resistant workforce for our future. So OHCOW, thank you. And for all the partners who make this series possible, thank you for your being here today and your commitment to occupational health and safety. Thank you so much.
Thank you, Dr. Moody, and I hope you will stay for a little while, but understand if you don't. And you're obviously more than welcome at all the sessions, and you're busy at hard work, but your words go a long way. And really, I'll let you share the screen, Holly, now for to pass it to continue in Dr. Moody's words. Really some of our updates, but I took a little bit more rope with across Ontario, just with Dr. Moody leading out the OC illness leadership table that I sit on, and the former co-chair of the OC illness prevention steering committee, Lens, and to our points with the Jay's hat, what's going on nationally and internationally, and beyond the boundaries and barriers, and breaking them down, the silos and et cetera. And why? Because I really think that everyone should have occupational health foundation, worker empowerment, everyone, every day. And we saw that in the pandemic, to Dr. Moody's comments, where, and I've said it before, but I really believe it. And I also, because I believe that multidisciplinary teams and worker empowerment solve problems. And so that's where we're going with our little updates this morning. So we'll take the next slide, Holly, if you will. I'd be remiss not to mention, oh, darn, oh, thanks. Retirements of some legends. So as we say, the October event really did start with Val Wolf, our director, who has both Michael Roche, our CEO, and Val Wolf have retired, and we are missing them dearly, and we stand on their shoulders. And again, Val's work at ODAP and now the OC illness prevention steering committee, and began the October, which has become a flagship event across the OHS system partners. And so I did want to acknowledge both Michael Roche and Val Wolf, and also mention that Dave Wilkin, who many of you know, is our interim CEO. So Dave, I just wanted to shout out to you with our leadership as I continue the theme today, and just making sure if you wanted to go on camera, you're welcome, and if not, I just wanted to acknowledge our past and our way forward. So yeah, Holly will go to the next slide. Speaking of leadership in Ontario. Oh, there you go. Thanks, Dave. He's multitasking as usual, but he's here with us, which is appreciated. So the leadership piece is really to call you all to action. You're here, as Dr. Moody mentioned, so inspiring, so much background and all the change that has occurred. Yes, we have long ways to go, but we have, we have made so many inroads with his leadership and across the system partnerships. The silos are coming down, the barriers are getting broken, when I did want to mention a few things just professionally with Ontario leading the way, and one of them being the fact that the Canadian Occupational Health and Safety Professionals Association is being looked at kind of like an umbrella organization led out by the BCRSP, but also including ACE, the ergonomists, and OHCOW, the Occupational Health, Occupational Hygiene Association of Ontario. See, it's alphabet soup that I'm adding to here, but the Canadian Occupational Health and Safety Professionals Association, bringing together the Canadian Board of Occupational Hygiene, the ergonomists, safety professionals, and on the model that came from New Zealand, really, where they also include occupational physicians like Dr. Moody, occupational health nurses, physiotherapists, and really trying to bring occupational health to the forefront by these multidisciplinary teams, which really is a lot of what OHCOW's makeup is. I would also like to mention the GOSH Coalition, which I want to get this right, so I'm pulling up my notes about again, more alphabet soup, but the global Occupational Safety and Health Coalition that we're proud to be part of at OHCOW as a new effort for greater worker protections globally. And proposing changes to UN Sustainable Development Goals, which was formed shortly after the International Congress on Occupational Health in 2024. So this coalition is informal. OHCOW's part of it. I'm part of it, trying to find others to sign on to. So this might be your call to action in your workplaces, but looking for a 50% reduction in work-related morbidity and mortality by 2050. Through basic occupational health services for all, including informal workers, and better protection of young workers and protection of worker adverse health effects due to climate change. So there's a reestablishment of the joint ILO and WHO committee on occupational health, and countries are ratifying the ILO conventions to ensure safety and protection of all workers, and for countries that have not done so to adopt the ILO conventions. The other amazing leadership going on that Joel might have alluded to a little bit is our federal government ramping up efforts to harmonize OHS regs across Canada to support labor mobility for workers and workplaces. So the ESDC, the Employment and Social Development Canada, are working closely with provincial and territory partners, and in fact, the deputy ministers recently met with efforts in this regard. So I'll come back down to what our realm in Ontario, but Ontario is actually helping lead the way in those efforts. So that's the kind of message I wanted to send here today as well. So the occupational illness leadership table was, if you recall, there was a OCDISEASE landscape review written mainly through a clinical lens that I sit on the table with to support, with really the involvement of the Ministries of Labor and the Ministry of Health and Public Health, with that, again, that clinical lens of improving occupational health and the occupational disease landscape in Ontario. And it had 41 recommendations, and this leadership table is working on implementing from those recommendations. You'll hear later this week about the WMIS framework working group And there's worker exposure history work going on as well that helps. I want to shout out to IWH for their ECHO OEM program. And also the ministry working on an occupational exposure registry, which was supported by OCRC. And another project we wanted to shout out to, that you have QR codes on your screen in relation to our looking for primary care physicians and clinicians, I should say, practitioners to enhance patient care with a work and health pilot. So should you know any primary care clinicians that would like to join this study through Dalhousie University, we are supporting it and looking to help recruit. So we wanted to take a moment to do that today as well. So the QR code will give you more information on that project. And the other piece is the OC disease awareness campaign. So that's also being actioned through the OC illness leadership table. And we have an example of what we did with the Ontario Silica Control Tool, which could be used as a model, which could many others with the tagline "Work to Live." About OC disease awareness. So they are actioning some of these items from those recommendations of the report. So next slide, please, Holly. What else is Ontario doing about occupational illness and partner initiatives? Well, the OC Illness Prevention Steering Committee, the formerly ODAP that I mentioned, Val, at the start. And again, the larger projects for those, as supported by the ministry, are the Ontario Silica Control Tool, which I'll talk about, the Heat Stress Toolkit, many research initiatives from our research partners. We are looking at the prevention strategy that Dr. Moody perhaps mentioned, that they're seeking input from all stakeholders for the new prevention strategy for the years of 2026 to 2031. And we have always been talking about occupational exposure limits as well at that table. So next slide, please, Holly. So what about the Ontario Silica Control Tool? So we're very happy to say that, and if Dr. Moody's still here, the stark contrast is evident. So he can be expecting an email, but there are over 1,000 account holders for the Silica Control Tool, although we are getting lots of feedback that the WSIB account number is a barrier to people using the tool. And you'll see from the numbers of the Heat Stress Toolkit that is open access, it's just a stark contrast. We have 11,000 downloads to the Heat Stress Toolkit. So we need to figure out a way to break down that barrier, and we'll chat to that later if you're still here. But it's been very successful. But there are, that's pointed out in some of the in some of the feedback as one of the kind of barriers to use. So there's been exposure analysis risk, which lead to exposure control plans, nearly 1,000 of those, at which we estimate reduced by silica exposure if they were actioned by an average of 40%. So this has been, this again, if you recall, was developed in BC. We've had demo sessions with BC RSP members as well as OHCOW last year. And again, a big collaboration with IHSA to host session for the Ontario Gravel. Oh, sorry, I probably missed C. Alphabet soup. I'm going to mix that up. So I'll just say OGCA for now. And next slide, please, Holly. Also, we have the surface mining version. So again, partnering with BC. Again, you can see the partnerships being the theme here, breaking down boundaries to access a surface mining version using BC mining data. So again, a call to action for you folks who are leaders in this effort is for data. For data for both the surface mining and the construction versions, because the more data we can get, the better the tool can be. Yes, but using the same platform, you can enter both versions. And we have shared this tool with the OSSGA, Ontario Sand and Gravel Association, and in the health and safety meeting and in their weekly newsletter. And Melanie will be presenting on the surface mining tool later in this event series. As well, we're hoping to increase collaborations with Workplace Safety North and IHSA on this new version. Next slide, please. Holly? What's stuck on you? Oh, yeah, and or I'm stuck. There's a French version, again, in a collaboration with New Brunswick across Canada, who were very kind to provide us with a French version. It's kind of a little bit stuck right now, but it will get unstuck. And our team also helping out with a French version. So we've been promoting the tool all over. I'm going to go a little more quickly because I might be taking up a lot more time, and you can read the slides. So next slide, please, Holly. So what are the next steps for Silica? And I should have mentioned this at the outset. The leadership, again, not just standing on the shoulders of our previous leaders, but all of our staff are the leaders in this regard. Whether you're working on the Silica tool, whether you're part of the ergonomics team, the workplace mental health program, the occupational illness prevention program, our hygienists, our occupational health nurses, our client service coordinators. So Kevin sits at the data evidence and knowledge mobilization and has really pushed the efforts of Engineered Stone. So we are trying to look at what can our silica prevention activities look like? Can we reduce the exposure limit? That's been a push since the beginning. WSPS, who you'll hear from, has provided in additional data to the tool for Engineered Stone countertops. And we hope you have been promoting the silica control tool as well in your own environments. So next slide, please, Holly. And I mentioned talking about the other huge effort of the OHCOW Illness Prevention Steering Committee, formerly ODAP, has been the refresh of the heat stress toolkit. So thanks to you, we have had over 11,000 downloads of the toolkit. There's been a lot of seasonal outreach from OHCOW's TNO and teamwork members to Ontario's migrant agricultural workers, lots of projects there. Also translating some of these resources into Thai and Tagalog. Workplace Health Without Borders had a presentation with regard. There's been an app in development. Big shout out to John, who originally came up with this calculator, and our labor partners. There's to Andre with data collection going on at the OFL and USW. And then this data will inform updates to the toolkit and potentially create a database of more data to drive prevention. Next slide, please. And I also, again, this whole theme of the Venn diagram of occupational health includes, traditionally we focused a lot on, illness in the cancers and in the traditional way, but our folks from our injury prevention program and our ergonomists, again, a big shout out because October is Global Ergonomics Month. And they've been supporting the ministry initiative on advancing vibration risk management and the hand-arm vibration syndrome, and provided video playlists that you can access on YouTube. And again, these are, as always, these sessions are recorded and slides will be available so that you can click on some of the resources to see them afterwards. And they've also been working hard at updating the Job Assess tool. So yeah, next slide, please. And speaking of which, on our other programs, so we have occupational illness prevention, injury prevention, and workplace mental health. So a big shout out here. We just had World Mental Health Day. I just participated in a Public Services Health and Safety Association Eastern Ontario initiative that had all the partners speak at with their updates. We've done numerous stress assess and mini MIT projects, one of which spoke at that conference as a well-being champion, and what she's done with stress assess as her foundation, and then grown and grown and grown and grown in her healthcare organization is nothing short of phenomenal. So a big shout out to Haley if she's listening. But we had a partnership to survey construction workers, which is ongoing with IHSA. We have Daryl, who's part of the International Steering Committee as a representative. Do check out May Day, which was also successful, and again can be looked at in arrears. We'd like to really call them on demand for your joint health and safety committees or as a health and safety reps. All of our past events, including RSI Day and May Day, and upcoming with RSI Day, can be accessed depending on subject matter that you're looking to hear about. Next slide, please. So other initiatives, there are millions. And again, a big shout out to all of the leaders in our organization that lead out these working groups that are sitting in various tables, whether it's the Mine Legislative Review Commission, speaking at the mining conference on diesel exhaust, on heat stress, looking at various universities where Toronto Metropolitan University with some research on lead in bone, and also a CHAP risk tool. OCRC is speaking later this week, and we're involved in the project advisory committee on the co-exposures project. We do TLV submissions trying to drive change with occupational exposure limits quite regularly. We're involved in a community of practice with the International Occupational Hygiene Association for sensor technology. We are supporting the International Association of Firefighters on funding for Health Canada under Firefighter Cancer Research Program. We have pesticide projects and nail salon projects going on with in the occupational illness prevention realm. And recently been looking at noise under the leadership of Alberta, who's looking at fit testing of hearing protection as part of their legislation. So there are many, many more, but I did want to give an overview of a few of them. I couldn't name them all. And next slide, please. And really what Dr. Moody was talking about at the outset, that really our tertiary prevention that we work on 90% of the time at OHCOW with our multidisciplinary team is looking at forensic work, retrospective work in our individual client files and our clinical cluster investigations. But this does drive our primary prevention efforts. So we try to leverage what our learnings are from all of this great work to then help with our primary prevention activities. So I would go ahead to the next slide, Holly, and just say that so join us. Enjoy today, where you'll be hearing from IHSA as well, and Workplace Safety North. I was lucky enough to be able to present with Steve at a recent OHCOW conference, and this is part of we're breaking down barriers, we're empowering workers. It's a very exciting initiative that I hope you'll enjoy hearing about as much as I did. And the week after, we are going to speak about WHMIS information and chemical exposures, growing on that Occupational leadership table recommendation from the landscape report. We're going to hear from the government of Nova Scotia and also WSPS in this regard. Week 3, we have Melanie Gormaning again, and Giovanna from OCRC and Tracy Kirkham talking on a few of the projects that they are working on. Always happy to have partners. And then week 4, we're going to talk about OC disease combating underreporting with our own Sarah Rhodes, epidemiology, and OCRC as well. And then we have a session on protecting vulnerable workers. Hopefully with this theme, we're trying to bring you That's so important that we reach all workers, and it's really hard to reach informal workers and those with the most need. And we hope to have you get on board in your leadership with that as well. So those are my quick updates. I hope that was okay, folks, and I will hand everything back over to Krista. I can stick around for questions, but if we're behind, I'll just hide and be here.
No, I think we're fine. We did build in a little bit of a buffer. One thing I didn't mention earlier was that if you do have questions, you're welcome to put them in the chat for those watching live. And at the end of each session, we'll give you the chance to unmute if anyone does wish to actually vocalize. So feel free to do that if you have any questions for Kimberly. And we will see, I'm not seeing anything. I'll just give it another moment. The other thing, while we're giving it just a moment to see if anyone does have any questions, that I should have mentioned earlier is in the bottom left-hand side of your screen, you can see a little square or rectangle that says CC in it. You can turn on closed captioning if that is something you wish to have. If you're watching the recording later on YouTube, I believe YouTube will have the ability to show closed captioning as well. That will come up only for you. So if that's something you wish to have, you can go ahead and do that. So I'm not seeing any questions, Kimberly. So
And Dr. Moody, I believe, is still here if he's willing as well. I just wanted to point that out if people have questions for him. If not, that's okay too, but with our joint introduction.
okay.
Okay.
I remember the drama of the Braves and Jays in their World Series.
Great. See how aligned we were, Dr. Moody and I? We didn't even know it. I knew we would be. I knew I just had to give you the title, and we were like
Always
we practiced.
simpatico. Always.
I know. Okay, they want to hear the good stuff. So not that we're not. We'll let from our partners. That's great. Thank you again for being here.
Okay, so I will introduce our next speaker. We have Jasmine Kalsi. Jasmine is an experienced occupational hygienist at the Infrastructure Health and Safety Association, also known as IHSA. She joined the organization in 2022. A registered occupational hygienist certified by the Canadian Registration Board for Occupational Hygienists. Jasmine holds a Bachelor of Science in Chemistry from I am tripping over my words today. Simon Fraser University and a Master of Science in Occupational and Environmental Hygiene from the University of British Columbia. With over 7 years of experience, or I think that should be 8 years now, of experience in the occupational health and safety field, she's developed expertise in the construction, manufacturing, and healthcare sectors, applying her knowledge to help create safer, healthier work environments. So Jasmine, welcome. I'm going to turn it over to you.
Perfect. Thanks for the introduction, Krista. Can you just confirm you can see my PowerPoint? And
Yes,
you hear
I
me
can.
well? Okay, great.
Thank you.
Alrighty. So yeah, hi everyone. So thank you again for the introduction. I was invited to speak on some recent occupational hygiene projects, as well as some relevant OC-related resources that us as like IHSA we have now available, or something that is upcoming. So starting off first, I'd like to just give an overview of IHSA, which is the Infrastructure Health and Safety Association. So IHSA is part of Ontario's health and safety system. It is a designated safe work association, and we're recognized as designated trainers, consultants providing services, meeting regulatory requirements, as well as compliance standards. So as you may or may not know, IHSA does serve a select number of industries. So that includes construction, electrical utilities, aggregates, natural gas, ready-mix concrete, and transportation. And we also work very closely with industry partners and labor associations. So we have this thing, it's called the Labor Management Network, and it consists of industry-based advisory councils. We have 2 provincial labor management safety committees, and these are designated as the Section 21 committees. They represent both the electrical and utilities industries. So this slide here, I like to put it in before I get into my presentation, just shows where we fall under Ontario's health and safety system. Again, we have sister partners under the Prevention Network. OHCOW is one of them, WSPS, WSN, PSHSA. So that was just a quick overview of who IHSA is, as well as where we sit in the health and safety system. So for today's session, I'll just be focusing on three main topics, I guess. So I'll just go over some recent hygiene assessments that we've been doing, projects we've been involved in, and CSO updates, and some new and upcoming resources that I'd just like to bring some attention to. So I'll start off with some recent hygiene assessments. So these have been done over the past few months. Some of them are still ongoing. So I'll only be sharing one of them a little bit more in detail. That's what I can do at the moment. So over the last few months, we've had done some assessments. They are on the smaller scale. These are not large scale studies or anything like that. But recently, or earlier this year, we did a study on insulation fiber assessment. So checking for worker exposure to mineral fiber as well as fiberglass. We did a project to assess for worker exposure to in drywall installation, so specifically testing against respirable crystalline silica and dust in a commercial building environment. This project is still ongoing. We just didn't need to do the residential sites and just a comparison between commercial and residential. Other assessments we've been involved with are a couple of noise assessments, a major utilities company in Hamilton, a major shipping hub in Etobicoke. And then we've also done an assessment of a surface mine in Uxbridge, so getting involved in the aggregates, assessing for respirable crystalline silica, as well as noise exposure. So I can only go over one in detail, and I'll do the first one on the list, so the insulation fiber assessment. So a little bit of background on how we first came about this. So as I mentioned before, we have the labor management network, right? So under this network, we have a bunch of trade committees, and insulation trade is one of the committees we have. So in this labor management committee, members brought up a concern of, being like, hey, our workers, are they overexposed to mineral fiber, fiberglass during the installation and removal of heated insulation products? So it was a focus more on the heated insulation. So this committee took upon this project to look into getting an assessment done, just to get a preliminary understanding of where they sit in terms of exposure, should there be a big concern around this or not. So we did this assessment, I think we did it it was early spring. We did this at Ottawa Hospital, a hospital that was undergoing a lot of renovations, and we focused on the removal of heated insulation, as I was asked from the committee, as well as the reinstallation of new insulation. So we assessed for mineral fiber exposure. So to give you an idea, so look at the pictures on the left. So we had 3 enclosures around breaching insulation. They were set up. So these enclosures, as you see, they were small in nature, but they were 4 feet by 5 feet. One worker was allocated to each enclosure for the duration of the task. And it was noted that the fiber that was being removed in these 3 enclosures, that insulation was historically heated up to 500 degrees Fahrenheit for a number of years. And the removed fiber was noted to have like a olive greenish color. And the tools that they used, they didn't use any power tools or anything. It was all hand tools, like box cutter knives. That's what we used for the workers. And to assess for fiberglass, those are the pictures on the right side. The task was completed in the boiler room of the building. So you can see what that looks like, what that environment looks like. So again, similar to the mineral fiber, the fiberglass was heated for a number of years. It was removed from active heated pipe, and the pipe was, from what we measured, it was at 216 degrees Fahrenheit. So the removed insulation was noted to be like a light yellow color. So the mineral fiber, that was a greenish color. This one was a light yellow color. Again, it was a lower temperature. But again, workers use similar tools, again, manual tools itself for the cut and removal of heated fiberglass, box cutters, knives. And again, similar tools were also used for the reinstallation of new fiberglass as well. So from this small study, from our collected samples, for the task of removing heated insulation, so both mineral and fiberglass, we didn't see any overexposures. Data was compared to exposure limit of 1 fiber per cubic centimeter in all cases, but all levels were found to be below the listed exposure limit for both mineral fiber and fiberglass. And the same result was also observed for the installation process as well. So this study itself, it gave our committee a better idea where they sit. And when we reviewed the project itself and a possible next step, it would be, again, to reassess for insulation fiber that has been heated to more extreme temperatures. In this project, we went a maximum of 500 degrees Fahrenheit. From their experiences, their user accounts, this suggested that when insulation fiber, when they're removing it, when it's exposed to higher heat, it usually looks white in color, and the white fiber is reported to be more prone to becoming airborne, and which can pose a potential inhalation risk. But in this study, we didn't see anything. We saw the olive green, we saw the yellow. So as a next step, with this committee, we're working on possibly in the future testing for this type of scenario where we can get access to insulation fiber that's been heated to higher temperatures, and then reassess for exposures as well. So it was an interesting study. We didn't really have this type of data in terms of our resources at IHSA, so it was a nice one to do, and just to get a little baseline in terms of where they sit. So that would be one of the assessments I'd like to share in this presentation. But I'm gonna now shift to go over some upcoming resources and events that I would also just like to take a moment to highlight to this audience. So one of the things I want to highlight is our Occupational Disease and Research Labor Management Health and Safety Committee. We are hosting a safety day. We did one back in 2023, and it was a great success. It was a sold-out event, and we're doing one this year, and it's actually next month. So on November 27th, we have a half-day seminar taking place at IHSA office. So it's near the airport in Etobicoke. And you can see the agenda on the slide. We have speakers from WSIB speaking on life of an occupational disease claim, speakers from Threads of Life speaking on a personal workplace strategy. We have speakers on to speak on the workplace medical monitoring programs from Workplace Medical Corp, as well as hear a first-hand success story from a committee member on how they navigated finding an occupational health hazard on an active job site and what steps they took. So it is a half-day session. Seats are limited, but I placed the link on the slide, and I believe they will be adding it in the chat as well for your quick reference. Everyone is welcome to attend, but it's something I wanted to mention in this presentation as well. And I just want to also highlight some recent podcasts that we've had on asbestos. So usually we do a series of podcasts on various health-related topics, as well as other topics as well. And the asbestos series, they were done with Michelle Baxter-Jackson from the Ministry of Labor. And she did a series of podcasts that just highlighted the notification responsibilities, the training requirements on asbestos awareness, and the legal training requirements for safe work, asbestos work in Ontario. So just want to point out that that's something that is available on our podcast page, and you can find it at ihsa.ca. And one of the other last resources I'd want to mention is our Occupational Disease Labor Management Committee has extensively been working on a manual or a guideline on the interpretation of Regulation 833. So this manual is designed to help workplace parties on construction projects comply with Regulation 833, so which is the control for exposure to biological and chemical agents. And this document is there just to provide guidance on assessment and control of exposures to biological chemical agents, including air monitoring, hierarchy of controls, and the use of personal protective equipment. So it's more catered towards the lens for like construction. So the information is intended as a general guideline only. We had a lot of collaboration in our committee. We have ministry reps as well. So this is a document that has been well vetted. So it's a near resource that is upcoming, and from my update from our marketing department is it should be readily available on our website by mid-November. So that's something you can find on our website as well. And before I end off, I also wanted to highlight some achievement from the NCSOs. So more than 1,000 safety leaders across Ontario have now been certified as national construction safety officers. So for those that don't know, the NCSO is the National Construction Safety Officer. It's a recognized safety designation across Canada. It's backed by all provincial and territorial construction safety associations that are part of the Canadian Federation of Construction Safety Associations. So to achieve this type of certification, individuals, they need to show certain skills. They have to help management run, improve a company's health and safety program, spot health and safety issues on a job site, and be able to communicate clearly with safety officers and any government reps, management, or workers. So this designation is meant for people who are actively involved in safety work on construction sites. So to qualify, you need at least 3 years of field experience, and you need to do a core student audit of your own of a company. So it's just one step towards becoming a leader in construction safety. So it is a great feat that we have 1,000 leaders now that have this designation, and the number is only growing. So that's something I just wanted to point out and just give a shout out to all of them as well. And that pretty much concludes my part of the presentation. My contact information is on the slide. I don't know if we have time for questions, if we're taking questions, but I do know that the presentation will be shared after.
Yes. Yeah,
Okay.
thank you, Jasmine. We do have time, a couple minutes for questions. Before I read some questions from the chat, I'll just note that Kate Whitke from OHCOW put the link to the Occupational Disease Research LMHSC Health and Safety Day. But if you're watching the recording, if you type just that phrase into Google with Eventbrite, you should find the link quite easily. So the first question from the chat is, did the workers follow asbestos type abatement procedures?
No, they didn't. For the insulation study, they didn't, no.
Okay. The next question is asking about if the heating up of the man-made mineral fibers at high temperatures is just a suggestion. You may want to see if cristobalite is being formed.
Okay, yeah, that's something we didn't consider. Yeah, that's a good note.
And I see Melanie Gorman-Ing's hand has gone up, or it was up a second ago.
Yes, hi, sorry, Krista. I wasn't sure if I was doing the wrong approach.
No, that's perfect.
This is maybe something that you've already discussed with OHCOW, so my apologies if so. Is there any chance that we could get the data from the surface mining study that you did for the surface mining silica tool?
Yeah, that's for sure. I just need to have to double check it with the site itself, but I'm pretty sure they'll be open to it. This was just a recent assessment we did, but we can be in touch about that. I don't think they should have issues.
Yeah, great. Thank you.
And I'll just note that Kimberly mentions in the chat that we are working to get OHCOW, the NCSO officers, trained and accounts for the Ontario Silica Control Tool.
Amazing.
For the Ontario NCSO officers. Any other questions for Jasmine? Not seeing any hands, not seeing anything in the chat. So thank you, Jasmine, for being here. That was great.
All right, thank you so much.
Thank you. So I'll introduce our final speaker for today, Steve Gore. Steve Gore is an occupational hygienist with Workplace Safety North, known as WSN. He's a registered occupational hygienist and a Canadian registered safety technician. He's a passionate bilingual occupational hygienist, a health and safety professional, and mental health and wellness leader based in Northern Ontario. With WSN, Steve specializes in mining, pulp and paper, forestry, and logging. So definitely sectors that are more concentrated in the north. Steve is currently a member of the board of directors with OHCOW, the Occupational Health Association of Ontario, and he just had a successful and well-received presentation at last week's fall conference. For those who were there, I think we all enjoyed that. Steve's also an executive committee member with CIM Northern Gateway Branch, and he still finds time to be a hobby farmer and an outdoors enthusiast. So with that, Steve, I will turn that over to you. You are welcome to unmute and show your slides.
Fantastic. Thank you for the introduction, Krista. We just make sure I can share properly here. And I'll put this up. Can you please confirm that this looks good and everyone can hear me okay?
Yes, I can hear you and I can see your slides. Thank you.
Okay, great. Past this point, I won't be able to see myself or any questions or anything like that. I'm working off a laptop in the lab right now. Not the best setup, but I'll do my best. So yeah, if anything comes up that I can't see, just pipe in, please. I'm honored to be presenting again this year at this October and Beyond series. Just yeah, feeling very fortunate to be part of this amongst our industry leaders. Humbled for sure. So I'm here today to talk to you about an initiative, project, a research program that WSN has started in 2025. And the hopes here is that maybe folks on the call can maybe spread the word and in some ways be part of this initiative. So I've entitled it "Mitigating Exposure to Occupational Health and Safety Health Hazards in Ontario's Natural Resources." So, like Krista mentioned, we're talking mining, pulp and paper, forestry, logging, converting as well, but essentially the conversion of raw materials, right? So I wanted to start off today by just showing a bit of a pie chart here of the different causal agents for occupational disease deaths. So this is specific to the mining industry. So I haven't separated out by industry here, but you can see there is some sort of legacy, I guess, exposure causing occupational disease deaths. Asbestos being obviously one of the ones that still remains high, with the majority of exposures happening decades ago. You see silica is not far behind. For those of you who aren't familiar with McIntyre powder, I don't have nearly enough time to dive into that today, but definitely recommend, if you haven't heard of that story, in brief, underground mining workers used to breathe in this powder that would coat the lungs to prevent silicosis and asbestosis. Little did they know that would cause some serious long-term health effects down the road. So that's another one we're seeing it over the last decade, seeing a huge spike in the diseases associated with the exposure to McIntyre powder. You see some other ones there too: dust in general, uranium. So you'd probably see some radon and radium, ionizing radiation exposure there. Diesel exhaust, that number has actually increased quite a bit, because exposure to diesel exhaust, or diesel particulate matter, DPM, similar to silica and asbestos, you have this sort of latency period and development of lung cancers, down the road. So we're seeing diseases and deaths associated with those exposures kind of increase. So after steel, mining is actually the industry in Ontario with the highest disease fatal rate. And you see a lot of the industries are much lower compared to steel and mining. You just have a lot of airborne exposures to multiple hazards and even designated substances, right? You see quite a few designated substance exposures in both steel and mining. So now to kind of talk about this project I wanted to bring to the table today. Throughout the winter 2024, 2025, WSN was sort of in talks with WSIB to apply for funding to sort of figure out how we can do more to reduce the number of occupational diseases and death associated with hygiene hazards. So during our spring mining health and safety conference that takes place every year at the end of April in Sudbury, we announced the funding of nearly $7 million for this new project, new initiative. And what it is, it's a collaboration between the WSIB, Workplace Safety North, and the Institute for Work and Health. And the project really is just to focus on enhancing hygiene monitoring and reducing exposure to workplace hazards. So we all know that hygienists are few and far between. But when you look in the north and you look at the geography and how far people have to travel to get support from hygienists, it causes real challenges financially, geographically, just logistics even. There's a lot of challenges. So we want to try and bridge that gap, right? Enable operations that are remote in these remote communities in Northern Ontario to be able to perform basic assessments, to be able to kind of collect that raw data as best as they can to start making risk-based decisions rather than wait, a couple of months to have someone like a consultant or even myself be able to free up the time to come up, and then also, from a cost perspective, sort of try to bridge that gap again. So the key objectives here to drive proactive health and safety improvements, and to empower workplaces to manage these invisible health risks, right? We're talking silica exposures, wood dust, DPM, noise, vibration, all these invisible health risks that are causing occupational health diseases and fatalities. So WSN's role in this is to develop specialized training materials in different formats, in person, e-learning, virtual training on the different aspects of really the basics of industrial hygiene 101, if you will, right? Someone who has an interest in it, that doesn't have much background, that doesn't know where to turn to get some level of training on it. So providing hands-on coaching as well, real-time hygiene monitoring. Really, they're shadowing these, they're shadowing us in their workplaces to kind of learn the most basic skills and take that on, right? Really, what I like to say is we're trying to teach them how to fish. And obviously there are some huge limitations. We're not making ROHs and CIHs out of these people, but really we're just trying to enable them with the many challenges they face to just, first of all, just get as accurate data as possible and then make decisions based on that data. So the Institute for Work and Health, their role in this would be to kind of lead the research portion of it and sort of help us kind of measure the difference in the difference in competency, or the journey in competency from, okay, what do you know about silica exposure? What do you know about ventilation? What do you know about PPE, respiratory protection? All those basic things before they kind of work with us, during the process of learning, and after the fact when we've kind of taught them how to fish, if you will. So measuring the change in competency, and is it effective, right? In what ways is it more effective? So the Institute for Work and Health is sort of leading that research piece, because we do have to demonstrate that there is some change happening in order for us to kind of continue on and receive the funding on an annual basis, right? So again, important to highlight that we do need to reapply every year with the scope change, and sort of prove that we've met some level of target and made some level of change to be able to kind of get that funding annually. So it's not just a blanket 5 years of funding. We do have to make some demonstration of success, if you will. So some theories we want to try over the 5 years is to equip operations with a degree of capacity for just even qualitative assessments. Forget the instrumentation or maybe basic instrumentation, but just what tools can we give them to make qualitative, IH reviews, to be able to make some decisions. From there, we want to try and equip them to be able to do actual quantitative assessments using instrumentation, direct reading instruments. The third goal is to equip the OHS system. So really that's WSN, IHSA, anyone involved in the OHS system to have them involved in the process as well, to upskill someone who maybe works for the system that doesn't have much hygiene background, so that we can sort of spread the knowledge, sort of this echo model, right? Almost like a train the trainer, spread these basic skills in the North, in these industries as much as we can, to just enable us to be able to collect basic data to make risk-based decisions. That piece is missing to a large degree in a lot of small operations and operations that are just really remote. If you look at a map of Northern Ontario, a lot of people think, oh, I'm going to Timmins or I'm going to Sudbury or North Bay. I'm going way up north. Those areas are just the cusp. Like if you look at a map, that arguably Sudbury, Timmins, North Bay, those to me are still, I would consider those still Southern Ontario. And I know that sounds crazy, but until you travel 12, 13, 14 hours north of Sudbury to go help, somewhere, you're halfway to Florida if you went south from Toronto. So picture how far that is, right? And how that just makes it really difficult for these places to have hygienists come, or even to have a hygiene team, for example. So again, these sectors that we serve, forestry, logging, pulp and paper, mining, there are a lot of respirable airborne hazards, right? Because we're processing raw material in the most raw form. You see a lot of those designated substances and airborne hazards. So there's a really big gap, like I mentioned. Accessible, practical training for health and safety professionals that work in these industries to be able to try and assess these hazards themselves. So reduce exposure, prevent illness, and meet stricter compliance standards is the goal. So I kind of already talked about this, but we're trying to improve worker health and safety itself, but also the knowledge. We want to try and lower fatalities and injuries and compensation claims. Even noise-induced hearing loss, it's so common in the North, and so we want to try and do more to reduce that. We want to support a scalable right fit framework based on workplace maturity. So if we have a small mom and pop operation, they still feel like they can be part of this program compared to maybe a larger organization that might have a hygienist already on site. And we want to enable long-term sustainable occupational health management. Sustainable is a huge part of that. Over the 5 years, we want to develop something that's sustainable, right? That when we're out of the picture and not fishing with them, again, analogy, that they can still catch fish, if you will. I apologize. I love fishing, apparently. So primary objectives, improve competency, have a demonstrated impact, and that's going to be mostly through IAWH's research, right? Identify factors that influence successful implementation. So every year our scope's going to change, how we deliver the training, how we interact in these workplaces, how we can improve efficiency to spread these skills as much as we can. That's going to change every year, right? So it's really a journey. So context, and then reach and capacity, again, same thing. Rather than us go to 10 different workplaces, maybe certain aspects of this project involves us hosting regional, hands-on training for 30, 40 people in industry, that they can then take those skills and bring them back to their workplaces. Because for WSN specifically, there's myself and my colleague Judith. We're the only hygienists in the North that work for Workplace Safety North. And again, if you look at the map of Ontario, we're stretched pretty thin. So, and then again, accessibility, I mentioned. We want to avoid a one size fits all. We want to have a model that doesn't matter how big your operation is, that you see a piece of the puzzle in that model that will help you. We don't want people to see this program down the road and think that's not for us. We don't fit into that. And we want to provide a bit of a clear path with sequence steps. So let's say you think you might have a silica and noise problem at your workplace. You know, those are the sort of tiered modules that we would train you on virtually, and then hands-on with the instrumentation. What kind of NIOSH method do you need to be, informed on? What would you request from the lab for analysis, for example? All those little steps, right? Short-term reduction in worker exposure, right? And that's huge because we don't want these operations to have to wait, several months for someone to come and do an assessment, and then another month to get a report, and then maybe another month to have them make a decision on the recommendations in that report. Not to speak poorly of this, the system that is consulting. Just in the north, we find that the timelines, often are quite extensive just because of what I mentioned before, logistics and geography. It's challenging. It's a challenging place to have things done, in a timely fashion. Long term, again, sustainability is huge. Increased workplace competency, right? So having them develop some level of self-sufficiency. And again, we're not making ROHs and CIHs out of these people. We're equipping them to be, I guess you would say, the equivalent of a junior hygiene technician that can then collect some data and come back to us with that, and we can help them through the process of implementing controls, right, and reducing the exposure to the workers. That's the goal. This slide kind of just speaks to, how this ties into, the WSIB's efforts to reduce illness and claims, right, and ultimately having less people in the workforce injured, hoping that people go home safe and healthy every day. And with respect to hygiene hazards, we all know a lot of this stuff doesn't hurt when you go home that day. You don't feel the effects of you losing your hearing, for example, right? So it's trying to shift the culture in the workplaces as well to sort of bring hygiene hazards to the forefront. And just because there's a latency period or there's more chronic health effects, that doesn't make it less important. So just talking about how we can measure success of the program. So based on people who might participate in this research program, selecting the assessment or monitoring data to determine what kind of hazards they have, right? So that's that qualitative piece. Before we even go in with, all this data analysis and instrumentation, just teaching them the basics of a qualitative assessment, and I'll speak to that in a second. But that's the kind of initial piece, right? After basic hygiene 101 training, if you will, we then move into, how do you perform a qualitative IH review? And those skills can be applied in multiple workplaces. Periodic assessment and monitoring to measure the control. So ideally, we're involved in this program with these companies who participate. From, hey, we're going to collect some data. What does the data tell us? What kind of recommendations are made? For example, we might say how you need to install some local exhaust ventilation in your welding shop. Maybe that's what the data tells us. And we see that through, right? That client then spends the money to have a local exhaust ventilation system in place, installed, and then we perform follow-up sampling to measure the effectiveness of that control, right? And being part of that journey, right? Because a lot of times we make recommendations to workplaces based on what the data we collected, and we might say, hey, we recommend a local exhaust ventilation system be installed here, and we hand them the report, and that's kind of where our involvement ends, right? Whereas with this project, we were hoping to see the finished product. Okay, the recommendation is actually put in place, and then we actually do some follow-up sampling and demonstrate that there's been a change, and hopefully observe a culture change in that workplace as well. So demonstrated impact, right? again, the Institute for Work and Health is going to be collecting data through different surveys and questionnaires and comparing the results of those surveys and questionnaires throughout the process to kind of measure the change. And again, our goal is to deliver training through e-learning modules, hands-on workshops in a regional way. So, for example, we could host a workshop for a whole week in Sudbury, and then the following month host one in Thunder Bay. That makes people closer to Thunder Bay, not have to travel 10 hours or 11 hours to Sudbury. They can drive to Thunder Bay, for example. Just make it easier for them to be able to do it. So we talked about this already, the e-learning, in-person regional workshops where we can actually have partnerships with workplaces. For example, we might have access to an underground mine that has a maintenance shop, and we might be able to bring these people that are participating in this workshop to that underground maintenance shop to show them how to, measure welding fume exposure, or how to measure hand-arm vibration from a hand tool. Little things like that. We're working on partnerships to be able to show as many people in these workshops how to measure it in the field. I'll move on here. I don't want to go over too much time. So again, the framework and this tiered approach is kind of what we're aiming to develop and work on over the years. And then we also kind of want to see, hopefully, people kind of more interested in participating, right? So hopefully not struggling to have people sign up to be part of this program, right? So that's where our industry partners and the OHS system will be able to help us with our outreach. And then just increasing the competency of people in Northern Ontario. The skill set that we have, most of us on this call, is just stretched way too thin in the north. And again, because of the nature of what we do, we process raw materials. The exposures are very high. So we really, really need more of those skills in the north. I'm going to skip over that slide, and I want to speak to firms. So 2025 was the first year we ran this project. We had 10 firms participate, and this was across mining, pulp and paper, and logging and lumber mills. So we had about 3-4 from each of those industries, all different sized operations. So some of them, only 10, 15 workers, others a couple hundred workers. And really, we want to capture the realistic snapshot of exposures in these workplaces, right? We don't really want to have firms that already have hygiene teams or have had, quarterly hygiene sampling programs in place for many years. Those people typically don't need as much help, right? We're trying to focus on the people that need help, but also that want help, right? So these are places that have IH issues that haven't been properly assessed, right? They just maybe haven't had the funding. For example, Kapuskasing paper in Kapuskasing just a couple of weeks ago shut down. And it wasn't until the federal government stepped in to get them to continue running just a week and a half ago, that they just they didn't even have enough money to continue their operations. So a lot of times a place like that is going to really struggle to have the funds to bring in a hygienist to do an assessment, right? Algoma Steel and Sault Ste. Marie, same thing. They were, almost forced to shut down until the federal government jumped in just a few weeks ago. It's a very common thing in Northern Ontario in these sectors to barely scrape by. It's not always that profitable. So making hygiene assessments accessible and sort of removing, to a certain degree, that financial burden, hopefully will make it more accessible. If that firm also has someone who has expressed interest in hygiene but just doesn't know where to start, or doesn't have the means to participate at any education programs with respect to hygiene, sort of removing those barriers as much as we can through this program. And then again, having workers who are have a known risk, people maybe who have developed asthma because they breathe in sawdust for the last 10 years, that a workplace that has that as a known sort of issue would be a good fit to participate. So I talked about qualitative reviews and how this is a skill set we want to teach people, right? So most of us on this call will be familiar with what this looks like, but it's interviewing workers, it's looking through incident reports and trends with respect to injuries, it's looking through SDSs of the products at the site, it's reviewing existing controls, how effective existing ventilation is in place, job task observations, review of the different roles at the operation, identifying different hazards that may require quantitative assessment based on what you see visually, qualitatively. So those skills are kind of after this hygiene 101, where you learn about, ppm and milligrams per meter cubed and NIOSH methods and all these things. The next step is to teach them how to conduct a basic qualitative IH review in a workplace, right? That's very foundational, and that can be applied to all different types of workplaces. So we spend a decent amount of time just on this concept and how to do it. And then what we did was actually they would shadow us in their workplace while we performed this whole process. Quantitative assessment's not new to anyone, right? Using instrumentation, lab analyses, direct reading instruments, whatever the case may be, what NIOSH methods apply, what kind of sample media do we use, all that stuff, teaching them how to do that. Sort of incorporating the risk-based decision-making model to our recommendations. So depending on where the data lies, with basic statistics, we kind of, we throw these exposure control categories and the associated recommendations to them, just to keep it as basic as possible. So if the data, shows us that we have silica exposure in category 4 at their workplace and a specific area, then these are the recommendations we'll make to them that they can then start working on, right? Again, this is a very basic risk-based decision model that works well for this project. The last piece of the puzzle here is that's important, I think, is internal upskilling. So Workplace Safety North and other health and safety associations and system partners, certain people within the system don't have any experience in hygiene. And this is an opportunity for us to have them participate and learn as well. So we're upskilling internally within the system as well. So we've had health and safety specialists at WSN participate and be part of this project, so that they then can maybe next year also deliver this. They're not hygienists, but they can maybe mirror what we taught them, and sort of, again, this echo model where you almost have this train the trainer kind of thing going on, where you can spread these skills. You don't have to be a hygienist to be able to teach someone the basic skills, right? So that's kind of the goal, and this is what's we think is actually gonna make an impact. And then finally, just the programs themselves. So this year we focused a lot on DPM, silica, and noise. We did some wood dust, obviously, because forestry and logging and lumber mills, there's quite a bit of dust exposure. Interestingly enough, if you don't know, there is a difference of a factor of 5 in the occupational exposure limits for softwood versus hardwood. So that's kind of interesting, because when we work with the lumber mill that processes hardwood, their OEL is actually 5 times lower. So, it's not a one size fits all approach when it comes to lumber mills. So little things like that. Welding fumes, right? VOCs, isocyanates. We see a lot of epoxy, kind of 2-part epoxy mixes and spray painting and stuff like that in industry, where isocyanate products are used. really, it's just where are we seeing the diseases and fatalities, and then sort of focusing on those. And again, DPM, silica, noise, those are the big ones that we see. So there was a big push on those. So yeah, I know I didn't dive too much into the.
Oh, did we lose Steve? Well, this is his last slide. So hopefully Steve will be back on in a moment so I can thank him properly. Are you coming back, Steve? So I'll just mention there is a certificate of attendance form in the chat. Oh, you're back. Wonderful. Okay, we've got a couple minutes for questions. If anyone has any questions, you're welcome to unmute now or put it in the chat. So thank you very much, Steve. That was I'm already semi-familiar with the program, but that bit of a dive into it was really great. I think it's like a fabulous idea. Anyone who's going to have remote or hard to get to sites will really benefit from this type of program. And as you say, the North is a different scale. I used to have a colleague who would joke that people from the South didn't realize, this is back when we had paper maps, when you turn the page on the map to go to Northern Ontario, the scale changes. So it is definitely a lot more remote compared to in the South. But, you know, if this can work and brought up to scale, it would be ideal for anyone who has any financial pressures or stressors on them. Okay, I'm not seeing any hands. I'm not seeing anything in the chat for questions. There was a comment, just sort of as an FYI, from Kevin Hedges, who's with OHCOW, just that Australia in next year is going to be introducing a lowered diesel particulate matter of 0.01 milligrams per cubic meter or 10 micrograms per cubic meter for respirable elemental carbon. So that is interesting. I know that OCRC, which is here in Ontario, they recommend 5 microns per cubic meter or 0.005 milligrams per cubic meter for prevention of health effects. So these lower levels will hopefully become the norm with better technology for prevention of exposures in particular.
Yeah, and I think we'll see the same thing apply for. Just to be clear, can you still hear me? Because I
Yep.
sounds like I might have cut out earlier.
You cut out for a moment there, but you're back
Okay.
now.
Okay, great. Yeah, I mean, you look at the ACGIH TLV for silica compared to the Ontario OEL, and there's a difference of a factor of 4, right? So there's some industry pressure to bring that down, and if and when that happens, that's really going to shake the tree, if you will, and create some challenges. But I think that's a good thing, right? So
yes, definitely. Yeah. Preventing occupational diseases is a good thing, but it's sometimes hard to get there, definitely. Yeah. So not seeing any questions. So thank you. I'll just thank you, Steve. Thank you for presenting today. And thank you to Jasmine and to Dr. Joel Moody presenting earlier. We appreciate that everyone was here. So the link for the certificate is in the chat. And I'll just remind you that if you want it, you will have to provide a little bit of feedback to us. Sort of our carrot. We will email those certificates out in mid-December once the entire session has ended. So I'll just remind you that next week we are back here again at noon for a session on WHMIS and chemical information. And that will be our second session for October. So I'll close it out by saying to everybody who is trick-or-treating tomorrow, stay dry if you've got the rain that I'm getting down here. It's supposed to be a very wet Halloween. And also, let's go Blue Jays. So thank you, everyone. As people are trickling out, I just hope we can leave it open for another minute, just in case anyone is trying to get that certificate of attendance so they can scroll up and get that link.